The first is the increasingly recognised importance of mental health to all aspects of health and well-being, and particularly in the area of suicide prevention. That population health is not possible without very targeted attention also on population mental health. The second, again, something which is very clear, I think, to all of us, is the demographic reality in Australia. We don't need to go through this in any details, but only to say that half the population is either first or second generation migrants. And in addition to permanent migrants, we have large numbers of temporary residents, for example, international students and foreign workers. And I might just stop there and say that the mental health of international students has been something that's been neglected for a long time, but is now receiving much more attention as part of our responsibility as a country to students who choose to come and study here. The third, and something which is always present, rarely acknowledged, is our legal obligations. And those are both obligations to international and domestic law concerning human rights, non-discrimination, and a host of other issues that are relevant to mental health, and particularly to multicultural mental health. I think there is an increasing commitment, not only in Australia, but globally, to issues of equity. And with equity as fundamental to justice, and that without equity, we continue to experience and to perpetrate all sorts of injustices, not only in our field, but in a whole range of other fields. And the fourth, and I think the most important issue, most sort of directly relevant issue, are the persistent disparities in access to decision-making. This is by multicultural communities, access to decision-making, participation, mental health services and programs, access to mental health services and programs, disparities in outcomes, and continuing deficiencies in workforce capabilities in relation to multicultural mental health, all of which constitute, in my view, continuing injustice as far as the way that our mental health systems nationally operate. So multicultural mental health and mental health system reform. I think when we're talking about reforming the mental health system, it's important to remind ourselves of what are the elements of the mental health system that require attention. So to achieve any sort of policy goals, mental health system reform requires simultaneous attention to, and often, and in this field certainly, substantial changes in multiple components of the mental health system. These include areas of leadership and governance, who leads, who makes the decision, how are our mental health systems, including our services and so on, governed, what are the processes for policy making, who is involved in those, to what extent are the people who are intended to benefit from the system involved in decision making about what the system looks like and how it operates. Human resources, always critical, and as I already mentioned, particularly deficient in relation to multicultural mental health. Here we can talk about the availability of interpreters as a kind of a baseline requirement which is not being met, and then talk about the availability of bilingual and bicultural workers who are in a position to best understand the particular perspectives, needs, but also the strengths and the resources in multicultural communities as part of the human resources, not just the formal workforce, but all of the other human resources, including carers, families, community organisations, that need to be brought in to thinking about how our mental health systems are designed and how they should operate. The kinds of services and programs that we run, I distinguish between programs and services in that there are multiple programs that need to be developed and implemented in order to make our services work efficiently and in order to promote good mental health, recovery from mental illness, and so on. So the services and programs and how well designed they are to respond to the particular needs of very diverse communities. And mental health information systems, and this is an area that I'll be focusing on quite a bit during this presentation as an example of some of the areas where we have particular problems. The other thing to say at the outset is that there have been multiple Commonwealth and state territory mental health policies really since the late 1980s, but particularly since the advent of the National Mental Health Commonwealth mental health programs in the early 1990s, that have very clearly expressed the intention to improve mental health services for immigrants and refugees. I would suggest that none of these policies has come even close to being effectively implemented over the past now more than 30 years. So let's say a few words about effective policy implementation. What is necessary for policy intent to be turned into actions, programs that actually make a difference that the policy area is concerned with, in our case, mental health policy. The first is policy design and planning. It's necessary clearly to create clear but also achievable policy goals, to be absolutely clear about where we're intending to go. Following that, we need to specify objectives. Who is responsibility, what are the objectives that are going to be progressively achieved in order to get to the goals that we've set ourselves? Who is responsible for which bits of the actions? What are the resources that are necessary? Where is the money going to come from to enable the things that need to be done? And who are the stakeholders? Stakeholders, you can use any alternative term you like. Currently, we are preoccupied with, as we should be, the involvement of people with lived experience, their supporters and carers in all of these processes of policy development and implementation. But they're not the only stakeholders. There are also those people who work in the mental health system and a whole range of other people who have a particular interest in how mental health policy is implemented and whether it's successful or not. Resource allocation. Without identifying and committing adequate budget and human and other resources, we can express any goals we want, and we can be sure that we're not going to achieve them if we don't devote the resources that are essential in order to be able to carry out the work that needs to be done. Execution by government agencies. This is really critical in the area of leadership and accountability. So government puts in place measures, laws, regulations, reporting requirements, and so on, that are effective in making sure that the policy objectives are actually pursued and the things that need to be done are done as intended. The bureaucracy, forgive the use of this term, but the people who are responsible for translating policies into action are usually people who, with the necessary skills in departments of health and in other areas, that turn the policy intentions into actions. Public servants that ensure policies are implemented in the way that is intended by the policy objectives. Clear communication with stakeholders is clearly essential. So, for example, if we are intending to reform the mental health system, then all of those who are involved in the mental health system, both workers and service recipients, users, need to be very clear about the changes that are being proposed, what are the intended outcomes, and what are the expected impacts on all stakeholders concerned. Who's responsible for doing and reporting on what needs to be done needs to be very clear, otherwise this doesn't happen. And that's particularly important in the area of monitoring and evaluation. So transparent and timely reporting, are the necessary resources actually available? Is the proposed implementation proceeding according to plan? What adjustments have been necessary in the initial planning when the planning confronts the real world? And are the policy goals actually being achieved? So I've taken a little bit of time to go through some of this. None of it is news, but all of it is important to everything else that I have to say this afternoon. So let me now turn to the Diverse Communities Mental Health and Wellbeing Framework, which was released by the Department of Health in Victoria a couple of weeks ago, and the accompanying blueprint for action, which is the actions that are going to be taken to achieve the objectives of the framework during the 10-year process of reform in Victoria that follows the Royal Commission. It needs to be, before I go into some of the detail here, it needs to be stated that we are now something like 4 years or more into the 10-year program of reform, and this framework has only just now been issued. A whole lot of things have been put in place in relation to how things are working in the mental health system in the absence of this framework. The intention of the Royal Commission is that these diversity considerations would influence all of the other decisions that are being made and the actions that are being taken. But we're more than 4 years in. We're about 4 years into the program, and this has just been issued. And the other point to make is that the Royal Commission made what I regard as a fundamental mistake in thinking about diversity, and that it has lumped together multicultural communities, gender diverse communities, and disability communities so-called, into the one bucket. So we're thinking about diversity in relation to all three of these large and incredibly diverse groups at the same time, which I think is very problematic. And I think some of the ways in which it's problematic are beginning to already emerge. So the 10-year vision of this reform plan, we should actually now say it's the 6 or 7-year vision of the reform plan, is that all Victorians can access a safe and inclusive mental health and wellbeing system that responds to, reflects and embraces diversity. Diverse communities experience equitable mental health and wellbeing outcomes supported by a system that values and affirms them, and by having equal access to the foundations of good mental health and wellbeing. This is a very laudable objective. I think it's one that we could all subscribe to. So let's see how we're going. The framework is divided into a set of principles. These principles are mostly fine, and I think most people would agree with most, if not all of them. And it's divided into 6 focus areas, as they're called, areas where there will be particular work being done in order to achieve that overall 10-year vision. I won't go into all of the details of these. It will take us too long to do that. So let's now go back a couple of steps. A little more than 10 years ago, we did a little bit of work, and I'm going to be focusing on the issue of evidences and data as an example of some of the problems with this framework. Little over 10 years ago, we wrote something that highlighted the many gaps in data. The sort of information that is absolutely basic to being able to first design an appropriate policy and to develop an implementation plan and to see whether the objectives of that policy are actually achievable, or what are the things that need to be done to achieve those objectives. In February of 2023, we were invited by the Victorian Department of Health to produce some evidence reviews for the development of the framework. And I want to say a little bit about both of those. The first was an overall evidence review about mental health of diverse communities in Victoria, and the second review focused on issues of mental health promotion and prevention in diverse communities. The outcome of those reviews is pretty plain. First, the amount and quality of evidence in relation to both of these areas remains inadequate, absolutely inadequate. Of the work that has been done, if we, as well as doing systematic reviews, we actually looked at the quality of the studies that were reviewed, and most of them, it has to be said, had to be rated as relatively poor. Now, this is not a reflection on the researchers who did those studies. It's a reflection on the amount of funding that's available, the unavailability of funding to do large-scale studies that would avert the design problems in the studies. But it remains the fact that most of those studies, the quality has to be rated as fairly poor. Continuing failure to invest in multicultural mental health research and a failure to collect and report the necessary disaggregated data from mental health services continues to be the case in most jurisdictions. And evidence for effective and responsive services still remains fairly weak, although there are many small-scale studies that strongly suggest that if we do certain things, we are able to produce good outcomes. The quality of that evidence, due to design features in the studies, remains rather poor. So what are the framework commitments on data and evidence? These are some quotes from the Victorian framework. There are long-standing issues with the collection, reporting, analysis of data, including mental health and wellbeing data for diverse communities in Victoria. So that's recognised. That as part of this, the framework, there is the intention to collect detailed and disaggregated data about people from diverse communities and their access to and experiences of mental health services to better identify and understand where services can be improved, continually improve the mental health system by responding to data insights, build on and use data and the evidence base in delivery and evaluation. When you turn to the actual implementation plan, there are no significant actions in the 2025 to 28 blueprint that will implement these commitments around data and evidence and how it's going to contribute to the reform process. When we did the review, we made a number of recommendations. Some of them had to do with leadership. For example, identify a position of sufficient seniority in the department who will lead and be responsible for implementation and so on. This leadership issue is not addressed in either the framework or in the blueprint. Fund the establishment of substantial and comprehensive multicultural mental health research and evaluation program that over the course of the decade-long Victorian mental health system reforms can contribute to the generation of evidence that is needed to inform the development of evidence-informed multicultural mental health policies, programs and services. That is not anywhere in the framework or the fund the early development of comprehensive policy and practice relevant diversity mental health research agenda that can guide research funding by the main research funding organisations in Australia. Commission a series of systematic reviews that will answer diversity relevant questions that are of most importance in this early phase of the mental health system reform program, support the research components of innovative pilot and demonstration programs and services that are co-designed, co-produced with CALD, LGBTIQ+ and disability community organisations. None of these recommendations has been adopted, and there is anything like these recommendations in either the framework or the blueprint. So if we go back to our policy implementation summary of what is essential in order to be able to implement policy, the bits in red are the bits that are missing from both the framework and the policy. There's been no specification of who is responsible. There is no budget and no indication of where funding is going to come from or whether there will be any funding in addition to what's already available to fund the reform program. There are no timelines beyond saying this is a 10-year program, 4 years into the reform process. Resource allocation, I've already said there's no budget. Execution by government agencies, there is no indication beyond saying the Department of Health will be responsible for these things concerning who is actually responsible for them. How this is done is very opaque, translating policies into actions. Public servants ensure policy implemented. There is nothing about ongoing monitoring and evaluation beyond saying that this process will be monitored and evaluated. One of the issues around data and evidence is the mental health information system. There was from the beginning an intention to entirely rethink the Victorian mental health information system. There are some very capable, very skilled people in the Department of Health who have done the work on that new mental health information system, but the mental health information system, the changes in it, have not yet been released by the department. So those who are going to be gathering data don't know what data they're going to be required to gather, how it's going to be used, where the resources are going to come from, how the data is going to be reported. None of that is yet known. So monitoring and evaluation is completely opaque. Transparent, timely reporting, are resources made available? No, we don't know that the resources have been made available. Is implementation 4 years into the program proceeding according to plan? Apart from ticks on the Department of Health website around the Royal Commission recommendations that have been actioned, there has been no other actual reporting. What adjustments have been necessary? Well, the main adjustments that have been necessary is money being pulled out of the reform process due to the parlous state of the Victorian government's budget. Are policy goals being achieved? That is anybody's guess. So, I've used data in the framework and blueprint as an example of what I would refer to here as policy design for implementation failure. Similar observations can be made concerning almost all of the other elements of the mental health system as part of the reform of the framework. In the absence of the policy implementation components that have been identified in the blueprint and the framework, the laudable objectives of the diversity framework simply cannot be implemented. So when things that are essential to enable changes in mental health practice are not done, no change, no significant change in mental health practice can seriously be expected. And that is where I think we currently are.